Okay. Good afternoon, everyone. My name is Joy, and I'll be taking you through the SHA provider portal. So the purpose of this session is just to take you through how you can be able to see clients or patients when they come to your facility and they are registered under SHA. So to start us off, I will take you through the portal and how you're able to access it. So the URL for this portal is portal.sha.go.ke. Emails were sent out to the different facilities. URL. Once you get the URL, this is the landing page, and what you can see from this page is the contact details for SHA in case you're having any challenges. So this is the phone number and this is the email address, and they will be quickly able to support you and give you the guidance needed. So now I will take you through what happens once you log in to the provider portal. So once you click login, you'll be asked to enter your credentials. So this is your email address and your password. So you will enter your details as has been provided in the email that was sent earlier on. So you just add your credentials and it will quickly log you into the portal. Once you get into the portal, the first page that you will see is the eligibility lookup page. On the right, on the extreme right, you will see your name of your facility. In this case, it is a test facility. You will also see your username. In my case, I am working as the portal administrator, so I'm seeing portal admin as my username, and I can also see the location at which I am tied in. So depending on your facility, that is the name that will come up. Then here, when you click help, you will see what the help details are. So you can send an email to this email address, or you can call the phone number provided to be given any further guidance. Then the other thing that I would like us to know as medical service providers or healthcare practitioners, that you should be able to download any desk, because at times when you are stuck at while providing care on the platform, then we would ask you for your any desk details so that we can be able to see what exactly you're seeing on your end. Now, on the menu side, you will see various information depending on the user rights that you have been granted. So you'll see things like the dashboard, which will show you how many claims have been or how many visits have been submitted over time, over let's say the past week, the last 30 days, more than 30 days, and such like things. If you're sitting at a head office level and you have multiple branches, you'll be able to see that information per branch. The other thing that you'll be able to see on the menu is the eligibility, the visits, and the authorizations. So at this point in time, what has been rolled out by SHA is the ability for you to start a visit against the different benefits, sub-benefit packages, and also the interventions. So we'll take you through the start visit functionality to be able to see how you should be able to provide care to the different patients who will be coming to your facilities, and they will be needing different interventions. So let me start off the training and take you through how this process is. So the first, I will take you through a test member so that you can see the information. So what you're supposed to do is enter their national ID number on this screen. So you search for the member using their ID number and click lookup member. So once you enter their ID number, you will see their name. In this case, this is test one user, and you're able to see their validity in terms of when the cover began and for how long it will last. Then the action at this point is to click the view button so that you can be able to see more information. So at this point, once you click the view button, this is the information that is presented. So you're able to see the bio details of the member. So for this test one user, you're able to see that he is a male and his date of birth is also given. And you're also able to see the relationship. You can also see the validity period, that is from October 1st to the end of September next year. Then you can also see the join date when he joins the cover. Then the other thing that you need to really be keen on is the member contribution status. So for us to pick contribution status, we need to get information from Afya Yangu. So if the as premium assessment records are not yet found, it means that the registration process has not been completed. So in this case, what you would advise the member is to complete the profile and the assessment forms and Afya Yangu, and then go on to payment. So what we'll be seeing is that this area will be changing over time. So as more members contribute towards SHA, the information will be changing here. So you'll be able to see those that are active and those that are inactive. So this section will be very critical in terms of how you see your patients as contribution information is updated more. Now, the other thing that you'll be able to see on this portal is the dependents under each of the members. So in this case, for test one user, we will look at their dependents. So in this case, we can see that this member has 3 dependents and all the dependents are children. So you can be able to view this information further, and you can also start a visit against each of the dependents if needed. If, for example, you only had the ID number of the parent. Now, looking at packages, which is where you'd be able to start a visit from, these packages are modeled against the benefit packages that have been rolled out. So what you should be able to see are all of the packages, and then you drill down to see the sub packages. So in this case, for the outpatient service package, can be able to see that the sub packages are outpatient PHC, there's the shift one, and then there's MCH. So assuming you're a level 2 or 3 facility and you want to visit for a patient has come for an outpatient visit, you would take the outpatient PHC journey and click the view interventions tab, and then say, for example, the patient has just come to see a doctor, you click consultation, diagnosis, and treatment. So this is someone has just come to see the doctor, they're not feeling well. So click on consultation. So in this case, when you get to this point, you will see that the authorization options are TP. There's a process to start a visit, a SHA authorized visit, and then there will also be biometrics that can be used to start a visit. So in this case, we will use OTP to start this member's visit. You will see their contact details and you will see that it is confirmed. So for data privacy reasons, we do not show the full phone number. So this member will use the OTP that has been shared to authenticate the visit. So I'm waiting to get the OTP for this member. I'm currently getting the OTP from my test user. So the OTP in this case is 654955. So I will verify this test user, and a visit will be started against that user. So now when you go back to see what visits and what authorizations have been made, you will see that member's information. So looking at, for example, today, all these members have been authorized via the different methods. So we had OTP that has been used. Let me show you on the reporting side. So you're able to see all the authorizations that have been done. So this is the date of the authorization. You can also see the timestamp. You can see the member details. You can also see the payer details. So in this case, this is SHA. You can see the status of the authorization. In this case, they have all been authorized and the way it was authorized. So there is OTP. As we continue working on this system, you'll also be able to submit claims and submit pre-authorizations. So at this point, what we want to be able to show to you is that you should be able to start a visit against a member based on the ID number that has been provided. And you will also select the intervention based on the type and the size of the facility. I hope that is clear enough. Let me just walk you through the process again. I will use my test user again. So you enter the ID number, you look up the member, you're able to see the member's name, the ID number, and the validity period. So you view, and then you're able to see the member's bio details. So in terms of the gender, the date of birth, and such like things. Then remember, we have already mentioned that we are integrated with Afya Yangu, so that we're pulling all the information that has been captured on Afya Yangu. So if you see that you're not able to see the contribution status, in that you cannot tell whether someone is paid up and they are valid, it is because the contribution information people have not started contributing. So as people start contributing, that information will come into the system, and you'd be able to see whether a member is active or not. Also, this message will also advise you to tell the patients that you are seeing to complete their profile on Afya Yangu, and the assessment forms also on Afya Yangu. Then the other thing that you'll be able to see on the screen is the dependents. So in this case, we have 3 dependents for this test user. You're able to see their date of birth and the relationship. So it could be a spouse or a child. So it could be a child or a spouse. Then the other thing that you should be able to do is see the packages. These are modeled against the benefit package that was rolled out. So these are the different packages. Then within each of the packages, there are sub-packages. So let's take the case that we want to start a visit. Someone has come for an inpatient case. So we'll start a visit against an inpatient service. So that is within the inpatient package. So you click the view sub-packages, And let's say this person has just come for inpatient only. It is not for critical care, rehab, palliative care, or any complications on maternal and newborn cases. So this is purely inpatient. So we can see the intervention in this case is management of medical cases, and the access point is purely IP. At this point, all benefits here do not require pre-authorization. So you can go ahead and admit this patient. So in this case, when you start a visit, it is synonymous to admitting a patient for inpatient services. So we want to confirm that we want to start the visit for a member against a benefit, and we're going to do that via OTP. So we have a contact detail, the contact details of our members. So we'll use that phone number. You'll use that phone number to authenticate. The old one. So I'm getting the OTP that was sent to our member earlier on, and inputting it. So if you put the wrong OTP, it will not go through. So you need to be very careful to ensure that you're using the right OTP. And for that, the visit has been created. Then the other workflows that we're going to make visible to you is how to create a claim. But for now, we will not touch on this. So you should be able to create a claim for this patient. You should be able to raise a pre-authorization. And then in the future, if there are any credit notes or debit notes, then you'll be able to add them. But for now, what we want to focus on is empowering you to be able to search for a member using their ID number. I think I have gone through the training, and I will pick questions from now. So I'm looking through the questions so far. So the login credentials, we started sending them over yesterday. So you should have gotten an introductory email from SHA letting you know about the portal you can use. So giving you this URL and also giving you the initial password that you'll use to log in. So those credentials were shared last night, and also they're still being sent within today. You can continue writing your questions in the on the chat box. Then I will answer them as we move along. Oh, I've seen I was too fast. Okay, I can go a bit slower. I'll do it again. So let me take you through the process again. So when you get the URL, this is the first page that you'll see. Let me zoom in for those who are not able to see. So you will see the support details, so who you can be able to call and where you send your emails to in case you need any quick support. Then you log in based on the credentials that were shared. So you enter your information, your email address. Then once you get onto the portal, let me zoom further. So once you get onto the portal, what you're able to see is the name of your facility. You're able to see the user of the facility. Then you're able to see how you can get help. So as I said, it's still the email address and the phone number. Then we'll ask you to download AnyDesk. It would be good to have that at hand so that we can be able to see what you're seeing in case you're stuck. Then in terms of the menu, what you will see is the dashboard. This will give you very good visibility in terms of the visits that have been started and also information in terms of the claims as we move forward to claims. So we give you a high-level overview of what claims have been unsubmitted over time, what has been submitted, and what is closed. So this will be very useful once we start the claiming process. Then the other thing now, which is what we're going to insist on, you should be able to search for a member on the portal. So in this case, we will search for a test member. What you need to do is just put in their ID number. And then you click lookup member. So what you can see here is the name of the test user. You'll be able to get the name, the ID number, and the validity up to when the policy will be valid until. Then after that, you just click view. Then you can see more information about the member you're trying to go through. So in this case, just user one, we're able to see their gender, their male, their date of birth, and then other information in terms of figuring out if they are the principal or the dependent. Then this will be a very critical section of the page as we move along. So you should be able to tell whether a member has contributed or not. So being that SHA is still new, contributions are still streaming in. So we will not see that information now, but as we continue to pick it, this section will change. Then the other thing is, for example, the premium records for this member also are not found. So what we advise is that you ask the member to complete their profile and also to go through the assessment form on Afya Yangu. So understanding the Afya Yangu process is also critical. Then the other thing that you should be able to see on the page is, one, you can look at the dependents. So for example, if it was a Joy who took her child to hospital, you can be able to search for Joy here. You enter my ID number as the mother, then you can see the children under my dependents, and then you go ahead and continue with the processes for the children down here. So in this case, you can see the 3 dependents, their dates of birth, and here now it will be the same process as the initial process I will take you through. So once you scroll down, you can also see the packages. These are modeled against the SHA benefit packages. So the packages are just as is. So you can look at the packages and see, for example, if your patient has come for an outpatient service as a level 4 or 5 under shift, then you can come and view the interventions for these outpatient services. So, for example, they've come for management of diabetes, for example, or something to do with diabetes. You should be able to start a visit against it. So it will be start a visit, not admit. So start a visit for the member. So this is admitting them into your facility and putting them onto the queue for services to proceed. Then for this member, we will ask that you authorize them via OTP. The other modes of authentication are having a SHA authorized visit and fingerprints that will be rolled out in the future. So now we will authorize this member via OTP. I will request for an OTP by pressing use to authenticate. So now an OTP has been sent to a member. This typically takes very few seconds. It should be less than 5 seconds for the OTP to be received. Then in case the member did not get an SMS, then you can click resend SMS. Then you verify the one-time PIN. So at this point, the visit for our patient has started, and that is all that is needed for now. As we progress with the process, you will be submitting claims on the platform, and you should also be able to submit claims pre-authorizations on the platform. The system is very well, this system that we're rolling out, so in terms of eligibility, is ready for use. As I said, there were credentials sent yesterday and they're still being sent today. So in case you did not get, kindly send an email to this email address provided here. And you'll have, we'll set you up against your facility, and you should be able to go ahead and use the platform. The other thing that you will get after this is we will share a training guide. So there will be a video guide and also a written manual for you to be able to walk through this process. So in short, that is what the process will be to offer services for the patients who are coming in. We will take you through the claiming and pre-authorization process at a later date, but for now, this is what we're going to cover. Okay, I'm going through the questions. For those who have not received your login credentials, please send an email to info@sha.go.ke. I'm looking through the questions on the chat box. If you have any, please let us know. My colleagues can also answer some of the questions that have been raised so far. This portal, you can start using it immediately to see the patients. So you will use it immediately for this eligibility and such, and to start a visit with OTP, via OTP. You can use it immediately. So since I have said pre-authorization and claiming is later on, what are you supposed to do when you see the patients? So continue to offer the services and using your normal process. Then when the claiming bits are ready for use, you can upload that information on the portal and send the claim. For now, we have removed the need for pre-authorization. So you should you should be able to offer services on the system as is. For biometric gadgets, we can you will use the gadgets that are in your facilities currently. So once that is up and running, we will also enable that. This system is not a testing system, it is live. There are facilities that have already started seeing patients. We've seen quite a good uptake so far with multiple facilities. I think quite a number of the facilities have been able to log in and they're able to authorize patients to see them, to be seen at their facility. So what if you already started a visit for outpatient, then later the patient is admitted? So you'll need to start a visit against the inpatient intervention because that is the intervention that you're going to be using. So if you started as outpatient and then later on it became inpatient, you need to start an inpatient, a visit against the inpatient intervention. Yes, you should start seeing clients under SHA. Okay, I think I have answered most of the questions. The email that you should be sending your requests to is info@sha.go.ke. Info@sha.go.ke. It's here on the screen and it will be responded to. Alternatively, you can call this number. The services will be offered on Monday. So services should be offered. The lack of the claiming portal, even by Monday, the the claiming bit will be ready. So we'll do another training on claiming and pre-authorization. The number is here on the screen, 0800 72 0601. We are not doing any invoicing at this point, so we'll answer those questions on attaching invoices and claim forms at a later date. So anything to do with claims, we will tackle that in a later session. The time will not expire before I take you through claims and pre-authorizations. This is going to be done very soon. So the number you should call is 0800 72 0601. 0800 72 0601. It's on the screen. The discharge functionality will be added on. Okay. I think in terms of the questions, I see there's a lot of questions on how do I pay for SHA. And the telephone number is MAND. So on payments, my colleagues, you can assist on the call. Hilda, there are a few questions that have been asked. Can be able to respond to. Biometrics. So biometrics, we will roll that out in the coming days. So for now, we're using one-time PIN. So if you want to initiate a dialysis patient, let me just take you through that. I'll enter my test user. I'll enter the test user 29. I'll look up the member. View. Then I will look at the benefits. So for example, dialysis is under the renal care services. They are both outpatient and inpatient renal care packages. So depending on which one it is, you will choose. So for example, if it is outpatient one, you start a visit against that, and then you can send an OTP. So you just need to choose the correct benefit package, the correct sub-benefit package, and then you should be able to navigate through. Login credentials will be shared as we move along. If you've not gotten any, please reach out to this contact details. You can also look at oncology, for example. So it is important to know which service they're coming for. Are they coming for a surgical service? Are they coming for inpatient services? So you know what sort of as a benefit package they are in, what intervention they are coming for. So I would really encourage that we go through the benefit package for us to understand where to start visits. Okay, I see some questions about registering and paying for SHA. I can see one about unable to select a location once you've logged in. Let me just get you a workaround for that. Helen? Hilda? Someone, you can answer some of the questions that are coming in. Okay, I think if you're having any technical challenges once you've been able to log in, please reach out to our support numbers. Call this number or send an email to SHA, and we'll quickly respond to them. For those without login credentials, you can also send an email, but we are still sending those out. All right. I think that is it for this session. We will have another session at 3 other sessions today. We will communicate on the timings for those other sessions. Thank you, everyone, and have a good afternoon.